Hi there, my name is Lynn and I am a second-year medical student at OSU College of Osteopathic Medicine. Our study today involves the willingness of rural college students to utilize at-home HIV and STI testing kits. STIs have continued to rise in recent years within the United States, according to the most recent CDC data. An estimated 37,000 HIV infections are diagnosed each year. What's even crazier is that almost 1 out of 7 individuals living with HIV are unaware Oklahoma is considered a state with a high HIV burden. As you can see, it's 19th highest for chlamydia, 10th highest for gonorrhea, 9th highest for syphilis, and the CDC designates it as a disproportionate rural HIV burden area. What can be done to reduce new HIV STI infections? In short, data indicates that the best way to prevent new HIV infection is to ensure timely diagnosis and engagement in care and treatment. Since the discovery of HIV/STI, the preventative toolbox has only grown, which is good for us. Testing is a key preventative strategy. Medications to prevent HIV and STI transmission, such as PrEP, is very good, and interventions to improve education and access to prevention tools, such as condom distribution programs, are also very good. Our sample consists of undergraduate students enrolled in a state-funded university within a rural county. They completed an online questionnaire, and the purpose of this questionnaire is to gain perspective and preferences for student health activities such as HIV and STI screening. The responses were coded by 3 team members, all independent from each other, then qualitatively analyzed to recognize different themes. Based on the questionnaire responses, we can see that students encounter numerous barriers to accessing HIV/STI testing sites, such as cost and stigma. Other testing barriers include embarrassment related to requesting a test and confidentiality concerns. The results portray that students desire a greater sense of privacy and the ability to be empowered through self-sampling methods. However, discuss concerns with potential use error that can impact testing accuracy. The orange boxes display illustrative quotes for each theme. An example of an at-home testing appeal on the bottom left is, quote, "I think that at-home testing would result in more students actually getting tested. It seems like a more discreet and convenient option," end quote. These barriers are amplified within rural communities where social norms related to sex and sexuality are increasingly restrictive and access to social health care is largely lacking. The finding of our study reflects this very notion. So as you can see on the left, 69% of the sample size stated they have never received an STI testing, and 73.3% of the sample have stated that they have never received HIV testing. Although the questionnaire preferences are a bit varied, students overwhelmingly endorse methods that allow for greater anonymity and quicker processing results. Here are some references, and thank you so much. My contact info is on the bottom, and special thanks to Dr. Hubach.